Question 1. A nurse is caring for a client receiving digoxin for heart failure. Which finding should the nurse report immediately? A. Heart rate of 52 beats/min. B. Blood pressure of 130/78 mmHg. C. Respiratory rate of 18 breaths/min. D. Mild ankle swelling. Correct answer. A. Heart rate of 52 beats/min. Rationale. Digoxin can cause bradycardia, slow heart rate. A pulse below 60 beats/min may indicate digoxin toxicity and should be reported before administering the medication. Strategy. Think. Digoxin slows the heart. Low pulse equals hold medication and notify the provider. Question 2. A client taking furosemide should be monitored for which electrolyte imbalance? A. Hypercalcemia. B. Hypernatremia. C. Hypokalemia. D. Hypermagnesemia. Correct answer. C. Hypokalemia. Rationale. Furosemide is a loop diuretic that increases potassium loss through urine, placing the client at risk for hypokalemia. Strategy. Loop diuretics lose potassium. Question 3. Which instruction should the nurse give a client taking warfarin? A. Increase intake of green leafy vegetables. B. Use a soft toothbrush. C. Stop the medication when feeling better. D. Take aspirin for headaches. Correct answer. B. Use a soft toothbrush. Rationale. Warfarin increases bleeding risk. A soft toothbrush helps prevent gum bleeding. Large amounts of vitamin K foods reduce warfarin effectiveness, and aspirin increases bleeding risk. Strategy. Warfarin equals bleeding precautions. Question 4. A client taking insulin becomes shaky and diaphoretic. What should the nurse do first? A. Administer insulin. B. Check blood glucose level. C. Encourage exercise. D. Restrict fluids. Correct answer. B. Check blood glucose level. Rationale. Shakiness and sweating suggest hypoglycemia. The nurse should first assess blood glucose before intervening further. Strategy. Symptoms of low sugar, check glucose first. Question 5. Which adverse effect is commonly associated with morphine? A. Diarrhea. B. Tachycardia. C. Respiratory depression. D. Hypertension. Correct answer. C. Respiratory depression. Rationale. Morphine suppresses the respiratory center, making respiratory depression a major concern. Strategy. Opioid slow breathing. Question 6. A client taking lisinopril reports a persistent dry cough. What is the nurse's best response? A. Stop the medication immediately. B. This is a common side effect. C. Increase your fluid intake. D. Take the medication at bedtime only. Correct answer. B. This is a common side effect. Rationale. ACE inhibitors commonly cause a dry persistent cough due to bradykinin accumulation. Strategy. ACE inhibitors cough and angioedema. Question 7. Which laboratory value is most important to monitor in a client taking heparin? A. INR. B. Platelet count. C. APTT. D. Hemoglobin A1c. Correct answer. C. APTT. Rationale. Activated partial thromboplastin time, APTT, evaluates the effectiveness and safety of heparin therapy. Strategy. Heparin equals APTT. Warfarin equals INR. Question 8. A client prescribed nitroglycerin for chest pain should be instructed to: A. Swallow the tablet immediately. B. Take the medication with milk. C. Place the tablet under the tongue. D. Take the medication after meals only. Correct answer. C. Place the tablet under the tongue. Rationale. Sublingual nitroglycerin works rapidly when placed under the tongue for angina relief. Strategy. Nitroglycerin for chest pain equals sublingual route. Question 9. Which food should a client taking monoamine oxidase inhibitors avoid? A. Apples. B. Yogurt. C. Aged cheese. D. Rice. Correct answer. C. Aged cheese. Rationale. Foods high in tyramine, such as aged cheese, may trigger hypertensive crisis in clients taking MAOIs. Strategy. MAOIs plus tyramine equals dangerous hypertension. Question 10. A nurse should question a prescription for metformin in which client? A. Client with hypertension. B. Client with kidney disease. C. Client with migraine. D. Client with asthma. Correct answer. B. Client with kidney disease. Rationale. Metformin can cause lactic acidosis, especially in clients with renal impairment. Strategy. Metformin monitor kidneys. Question 11. A client taking prednisone should be monitored for A. Hypoglycemia. B. Weight loss. C. Increased infection risk. D. Bradycardia. Correct answer. C. Increased infection risk. Rationale. Corticosteroids suppress the immune system, increasing susceptibility to infections. Strategy. Steroids suppress immunity. Question 12. Which instruction is appropriate for a client taking alendronate? A. Lie down after taking the medication. B. Take the medication at bedtime. C. Take with a full glass of water. D. Crush the tablet before swallowing. Correct answer. C. Take with a full glass of water. Rationale. Alendronate can irritate the esophagus. Clients should take it with water and remain upright. Strategy. Bisphosphonates water plus stay upright. Question 13. Which finding suggests toxicity in a client taking lithium? A. Tremors and confusion. B. Increased appetite. C. Dry skin. D. Bradycardia. Correct answer. A. Tremors and confusion. Rationale. Lithium toxicity commonly presents with tremors, confusion, and gastrointestinal symptoms. Strategy. Lithium toxicity affects the brain and nervous system. Question 14. A client receiving vancomycin should be monitored for A. Hearing loss. B. Constipation. C. Hyperactivity. D. Weight gain. Correct answer. A. Hearing loss. Rationale. Vancomycin may cause ototoxicity and nephrotoxicity. Strategy. Vancomycin ears and kidneys. Question 15. A nurse should teach a client taking levothyroxine to take the medication. A. With meals. B. At bedtime. C. On an empty stomach. D. With antacids. Correct answer. C. On an empty stomach. Rationale. Levothyroxine is best absorbed on an empty stomach, usually in the morning before meals. Strategy. Thyroid medication equals empty stomach. Question 16. Which adverse effect should the nurse monitor in a client taking aspirin long-term? A. Tinnitus. B. Weight gain. C. Hair loss. D. Hyperactivity. Correct answer. A. Tinnitus. Rationale. Tinnitus is a classic sign of salicylate toxicity. Strategy. Aspirin toxicity equals ringing in the ears. Question 17. A client taking clopidogrel should report A. Mild hunger. B. Bruising and bleeding. C. Increased energy. D. Dry mouth. Correct answer. B. Bruising and bleeding. Rationale. Clopidogrel inhibits platelet aggregation, increasing bleeding risk. Strategy. Antiplatelets equals bleeding risk. Question 18. Which instruction should be included for a client taking ciprofloxacin? A. Take with antacids. B. Avoid sunlight exposure. C. Restrict fluid intake. D. Stop medication when symptoms improve. Correct answer. B. Avoid sunlight exposure. Rationale. Ciprofloxacin can cause photosensitivity reactions. Strategy. Fluoroquinolones equals sun sensitivity. Question 19. A nurse should monitor for which side effect in a client receiving ondansetron? A. Diarrhea. B. QT prolongation. C. Hypertension. D. Hyperglycemia. Correct answer. B. QT prolongation. Rationale. Ondansetron may prolong the QT interval and increase arrhythmia risk. Strategy. Ondansetron affects heart rhythm. Question 20. A client taking hydrochlorothiazide should increase intake of A. Potassium-rich foods. B. Calcium supplements. C. High-sodium foods. D. Sugary drinks. Correct answer. A. Potassium-rich foods. Rationale. Thiazide diuretics can lower potassium levels. Strategy. Most diuretics waste potassium. Question 21. A nurse is teaching a client about atorvastatin. Which statement by the client indicates understanding? A. I should report muscle pain. B. I can stop the drug anytime. C. I should avoid drinking water. D. I will take it only when I feel sick. Correct answer. A. I should report muscle pain. Rationale. Statins may cause muscle injury and rhabdomyolysis. Muscle pain should be reported immediately. Strategy. Statins equals watch for muscle pain. Question 22. A client taking diazepam is at greatest risk for A. Hypertension. B. Respiratory depression. C. Hyperactivity. D. Diarrhea. Correct answer. B. Respiratory depression. Rationale. Benzodiazepines depress the central nervous system and may slow breathing. Strategy. Sedatives slow the CNS and respirations. Question 23. Which finding indicates therapeutic effectiveness of albuterol? A. Decreased wheezing. B. Increased edema. C. Reduced urine output. D. Bradycardia. Correct answer. A. Decreased wheezing. Rationale. Albuterol relaxes bronchial smooth muscles, improving airflow and reducing wheezing. Strategy. Bronchodilators open the airways. Question 24. A client receiving gentamicin should be monitored for A. Ototoxicity. B. Constipation. C. Weight gain. D. Hypertension. Correct answer. A. Ototoxicity. Rationale. Gentamicin can damage the ears and kidneys. Strategy. Aminoglycosides equals ears and kidneys. Question 25. A nurse should advise a client taking tetracycline to avoid A. Orange juice. B. Milk products. C. Rice. D. Bread. Correct answer. B. Milk products. Rationale. Calcium in dairy products decreases tetracycline absorption. Strategy. Tetracycline plus calcium equals poor absorption. Question 26. A client taking spironolactone should avoid A. Bananas. B. Rice. C. Apples. D. Chicken. Correct answer. A. Bananas. Rationale. Spironolactone retains potassium. Excess potassium intake may cause hyperkalemia. Strategy. Potassium sparing equals avoid extra potassium. Question 27. Which assessment finding is most concerning in a client taking phenytoin? A. Swollen gums. B. Headache. C. Mild fatigue. D. Increased appetite. Correct answer. A. Swollen gums. Rationale. Gingival hyperplasia is a common adverse effect of phenytoin. Good oral hygiene is important. Strategy. Phenytoin equals gums grow. Question 28. A nurse should instruct a client using fluticasone to A. Drink soda after use. B. Rinse the mouth after inhalation. C. Lie flat after use. D. Use only during emergencies. Correct answer. B. Rinse the mouth after inhalation. Rationale. Rinsing prevents oral candidiasis caused by inhaled corticosteroids. Strategy. Steroid inhaler equals rinse mouth. Question 29. A client taking ibuprofen is at risk for A. Gastric ulcer. B. Bradycardia. C. Hypoglycemia. D. Hearing improvement. Correct answer. A. Gastric ulcer. Rationale. NSAIDs can irritate the stomach lining and increase ulcer risk. Strategy. NSAIDs damage the stomach. Question 30. Which instruction is most important for a client prescribed nitrofurantoin? A. Stop medication once symptoms improve. B. Take with food. C. Crush the capsule. D. Avoid all fluids. Correct answer. B. Take with food. Rationale. Taking nitrofurantoin with food improves absorption and reduces stomach upset. Strategy. Some antibiotics work better with food. Question 31. A nurse should monitor a client receiving potassium chloride for A. Arrhythmias. B. Hair loss. C. Weight gain. D. Visual changes. Correct answer. A. Arrhythmias. Rationale. Abnormal potassium levels can affect cardiac rhythm. Strategy. Potassium problems equals heart rhythm problems. Question 32. Which side effect is expected in a client taking metoprolol? A. Tachycardia. B. Bradycardia. C. Hyperactivity. D. Insomnia. Correct answer. B. Bradycardia. Rationale. Beta blockers slow the heart rate and reduce blood pressure. Strategy. Beta blockers block fast heart action. Question 33. A client taking isoniazid should be taught to report A. Tingling in the hands and feet. B. Increased hunger. C. Excessive urination. D. Sneezing. Correct answer. A. Tingling in the hands and feet. Rationale. Peripheral neuropathy is a common side effect of isoniazid. Strategy. INH affects nerves. Question 34. A nurse should question a prescription for sildenafil in a client taking A. Acetaminophen. B. Nitroglycerin. C. Vitamin C. D. Calcium carbonate. Correct answer. B. Nitroglycerin. Rationale. Combining sildenafil with nitrates can cause severe hypotension. Strategy. Never mix nitrates with sildenafil. Question 35. A client receiving cyclophosphamide should increase fluid intake to prevent A. Hemorrhagic cystitis. B. Constipation. C. Hypertension. D. Hyperglycemia. Correct answer. A. Hemorrhagic cystitis. Rationale. Cyclophosphamide can irritate the bladder. Fluids help flush the urinary system. Strategy. Chemotherapy drugs can damage the bladder. Question 36. Which adverse effect is associated with codeine? A. Diarrhea. B. Constipation. C. Hyperactivity. D. Hypertension. Correct answer. B. Constipation. Rationale. Opioids slow gastrointestinal motility, causing constipation. Strategy. Opioids slow everything down. Question 37. A nurse is caring for a client taking omeprazole. The medication is used to treat A. Peptic ulcer disease. B. Hypertension. C. Seizures. D. Heart failure. Correct answer. A. Peptic ulcer disease. Rationale. Omeprazole decreases stomach acid production. Strategy. PPIs reduce stomach acid. Question 38. A client prescribed rifampin should be informed that the drug may cause A. Blue urine. B. Orange body fluids. C. Black stools. D. White saliva. Correct answer. B. Orange body fluids. Rationale. Rifampin commonly turns urine, sweat, and tears orange-red. Strategy. Rifampin colors body fluids orange. Question 39. Which assessment finding indicates an allergic reaction to penicillin? A. Rash and wheezing. B. Increased appetite. C. Bradycardia. D. Dry skin. Correct answer. A. Rash and wheezing. Rationale. Rash and wheezing may indicate anaphylaxis or hypersensitivity reaction. Strategy. Breathing trouble plus rash equals allergy emergency. Question 40. A nurse should instruct a client taking ferrous sulfate that stools may appear. A. Green. B. Black. C. White. D. Red. Correct answer. B. Black. Rationale. Iron supplements commonly darken stool color. Strategy. Iron turns stool black. Question 41. A nurse should monitor for toxicity in a client receiving theophylline. Which finding indicates toxicity? A. Drowsiness. B. Bradycardia. C. Tremors and tachycardia. D. Constipation. Correct answer. C. Tremors and tachycardia. Rationale. Theophylline toxicity commonly causes nervousness, tremors, and rapid heart rate. Strategy. Theophylline overstimulates the body. Question 42. A client taking acetaminophen in high doses is at risk for damage to the A. Heart. B. Liver. C. Lungs. D. Skin. Correct answer. B. Liver. Rationale. Acetaminophen overdose can cause severe hepatotoxicity. Strategy. Too much acetaminophen damages the liver. Question 43. Which laboratory value should the nurse monitor in a client taking methotrexate? A. Liver function tests. B. Calcium levels. C. Blood glucose. D. Potassium levels. Correct answer. A. Liver function tests. Rationale. Methotrexate may cause liver toxicity and bone marrow suppression. Strategy. Methotrexate can harm the liver. Question 44. A client taking digoxin reports nausea and seeing yellow halos around lights. What should the nurse suspect? A. Hypertension. B. Digoxin toxicity. C. Hyperglycemia. D. Dehydration. Correct answer. B. Digoxin toxicity. Rationale. Visual disturbances and nausea are classic signs of digoxin toxicity. Strategy. Yellow halos equals think digoxin toxicity. Question 45. Which statement by a client taking oral contraceptives requires further teaching? A. I should take the pill at the same time daily. B. Smoking increases my risk of complications. C. I can stop the pills anytime without consequences. D. Some antibiotics may reduce effectiveness. Correct answer. C. I can stop the pills anytime without consequences. Rationale. Stopping oral contraceptives suddenly may increase the risk of unintended pregnancy. Strategy. Consistency is important with birth control pills. Question 46. A client receiving enoxaparin should be monitored for A. Bleeding. B. Hyperactivity. C. Weight gain. D. Constipation. Correct answer. A. Bleeding. Rationale. Enoxaparin is an anticoagulant that increases bleeding risk. Strategy. All anticoagulants increase bleeding risk. Question 47. A nurse should teach a client taking captopril to change position slowly because of the risk for A. Orthostatic hypotension, B. Hyperglycemia, C. Constipation, D. Fever. Correct answer: A. Orthostatic hypotension. Rationale: ACE inhibitors can lower blood pressure and cause dizziness when standing. Strategy: blood pressure medications may cause dizziness on standing. Question 48. A client taking insulin glargine should understand that this insulin A. peaks rapidly, B. is used only during emergencies, C. provides steady glucose control, D. must be mixed with other insulins. Correct answer: C. provides steady glucose control. Rationale: insulin glargine is a long-acting insulin with minimal peak effect. Strategy: glargine equals long and steady. Question 49. A client taking trimethoprim sulfamethoxazole should increase A. caffeine intake, B. fluid intake, C. sodium intake, D. sugar intake. Correct answer: B. fluid intake. Rationale: adequate fluids help prevent crystalluria and kidney complications. Strategy: sulfa drugs need hydration. Question 50. A nurse is caring for a client receiving naloxone. The medication is used to A. reduce fever, B. reverse opioid overdose, C. treat hypertension, D. control seizures. Correct answer: B. reverse opioid overdose. Rationale: naloxone rapidly reverses respiratory depression caused by opioids. Strategy: naloxone saves breathing in opioid overdose.